Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana if you are new here. If you're not, thank you for coming back. Today is Wednesday, July the 21st, and I have a familiar face next to me, and that is our own Dennis Pillion of AL.com. He has really been one of our top coronavirus reporters for the last year and a half, which I hate even saying that. It sounds so crazy to say aloud, but that's the truth. So Dennis is joining me today to talk about a story he published this morning on AL.com. Some of you may have seen it, and if you have not seen it, it is about a doctor at Grandview Medical Center here just in Birmingham, right outside of the Birmingham region, and she's a hospitalist there, and she's been treating a lot of COVID patients. Now, Dennis did this story, and this is where the doctor has said, look, this is my feelings about people who are getting sick, especially those who are not vaccinated and getting sick. And it was just a really emotional story, a very emotionally charged statement from this doctor. So Dennis is here today to kind of recap that story and go a little bit further into his interview with Dr. Brytney Cobia and kind of her thoughts on the situation. So Dennis, first of all, a great story. We know it's kind of gone viral at this point. And this is from Dr. Brytney Cobia, again, at Grandview Medical Center. We'll get into some of her direct quotes in a minute, Dennis. But before we get into that, let me ask you, how did you get in touch with Dr. Cobia, and how did you first find out that she was speaking out against the unvaccinated population?
Yeah, well, it started out actually, appropriately enough, on Facebook. I did not know her before, but we had some mutual friends, and one of them shared her Facebook post with me that she had made on Sunday night, and that post, it's quoted in the story, and it's really just kind of an emotional statement about what it's like now, as a doctor. She's a hospitalist, which is kind of just your general physician who works in a hospital. She doesn't have a specialty, so she could be asked to do a whole lot of things. And what she's been doing, of course, for the past year plus is taking care of a lot of COVID patients. And, I think part of, what resonated about this is obviously it's very hard for her and doctors like her, kind of mentally, emotionally. They've been dealing with this strain and stress and, kind of an ongoing emergency situation that's waxed and waned a little bit, but they're still in it. They're still caring for dying patients every day. And now with Alabama's low vaccination rate and the way this Delta variant of COVID is just spreading like crazy, they're caring for people who, are there because they probably chose not to take the vaccine for whatever reason. So in a way, it's a preventable tragedy that they're now having to deal with. And that just, it requires a different level of kind of an emotional response from, there's this brand new virus that's circulating. We don't know what to do. It's, basically impossible to avoid it. And, some of these people are doing everything right, and yet they're still getting this terrible virus. They're still, knocking on death's door or dying, and there's nothing anybody can do. Now there is something that people can do with the vaccine, and yet we're still seeing hospitalizations and we're still seeing deaths. And it seems like, based on the numbers of new cases that we're seeing in Alabama and the number of hospitalizations, which have doubled since the beginning of this month, it seems like we're only going to see more of that here in the next few weeks.
Well, and we know, again, Dr. Cobia had put out a really emotional Facebook post, I believe you said on Sunday night, and it was just kind of her thoughts of saying, look, I've been treating COVID patients for the past year, over a year, and now I still am treating them. But the difference is that most of the people I am treating did not choose to take a vaccine for one reason or another. And she says out of those people, there's many of them who are dying. There is, I believe she said she had at least one vaccinated patient who she said was going to be okay. That person was getting oxygen and some other just non-invasive procedures or having some non-invasive care. But some of those patients who were not vaccinated were dying. Now, I want to get into some of the things that Dr. Cobia said in her Facebook post and in an interview with you, Dennis. And I want you to kind of tell us the way that she said this and how she felt about it. But one that I thought was really important, I'm going to look down and read it. And she says that this is in the context of saying if she has a patient die from coronavirus and she has to go sign that death certificate and then tell their family that they did die. This is a quote she said. She said, quote, "They cry. They tell me they didn't know. They thought it was a hoax. They thought it was political. They thought because they had a certain blood type or a certain skin color that they wouldn't get as sick. They thought it was just the flu, but they were wrong. And they wish they could go back, but they can't. So they thank me and they go and get the vaccine. And I go back to my office, I write their death note, and I say a small prayer that this loss will save more lives." Dennis, that's so powerful, and that is so raw. And I think that a lot of people, I think most of us can selfishly say, we think of our physicians as almost on a different pedestal, that they are so intelligent. They are doing this work that so many of us cannot do. And we forget sometimes that they are human and they have these emotions and they have these feelings. And when somebody dies, it's not just a number to them. It's not just another piece of paper to sign. It really does touch them. So Dennis, tell me a little bit more about this thought of her saying, look, when I tell the family, it hits them that COVID is real.
Yeah, and that quote that you just read, that was from her Facebook post, and obviously, that hits you right there, and just from actually talking to her and talking about her experiences, it's clear that this is an emotional thing for her and for all the doctors who are dealing with this. They're tired and they're worn down. It's kind of for those of us, the virus has changed everything for a lot of people, over the past year and a half. But to kind of, live in that constant pressure cycle, I can't even imagine it. And I do want to say, I think a lot of people, based on some of the social media responses, I think some of the people might not appreciate that she really is. She's trying to do the best she can for all of her patients, and she's trying to help them. But as she says in her posts, they're asking for the vaccine, but it's already too late. They already have the virus. They're already being put on a ventilator. At that point, and hopefully we can be like her and say a prayer and hope that by sharing these stories, then other people will realize how serious this is, and will do everything they can to protect themselves and the rest of us.
And she makes a comment in here of saying, and I think you use this as your headline, and I want people to know that we know a lot of people, for better or for worse, they don't read a full story. They read a headline and maybe a couple of paragraphs in the beginning. And one of your headline, I should say, was talking about how there are people who are dying or who are intubated. And she says in this post, she says, one of the last things they do, meaning patients, before they're intubated is beg me for the vaccine. I hold their hand and I tell them that I'm sorry, but it's too late. Now, we know these vaccines are designed to prevent coronavirus and rather prevent serious illness and hospitalization, death. They are not designed to cure coronavirus. So I think what the doctor is saying is that she gets to this point and then people have a realization, but it's too late to go back before they got sick and get this vaccine. And I want you to elaborate on that, Dennis, but first I want to get a couple of quick questions I'm seeing here before they go up too far in my feed. One, Mary Lisa talks about getting vaccines if she's a patient with AFib. Mary Lisa, I'm going to tell you what the doctor said, and that is check with your primary care physician. Call that office. I'm sure they would be more than happy to give you their thoughts. And that goes not only for you, Mary Lisa, everybody. If you do have a question about your specific medical condition, call your primary care doctor, and they will be, I'm sure, more than happy to answer those questions for you. That way you get trusted medical advice, and that is not coming from me. I'm not a medical professional. Now, again, going through some of these comments, I've got Amy saying, so what about patients who become sick again or die after they get a vaccination? And Amy, that's unfortunately, it's very rare, but that's true. And this is what Dr. Cobia says. She says she's in the majority of her patients did not get the vaccine. At least one did get the vaccine and was sick, but was not having a serious of an illness. So that is not discounting those patients' experience whatsoever. And I don't think that that was the purpose of these comments. Dennis, I'm going to let you answer another kind of question that we were talking about. And that is saying that, this is irresponsible of her to say it's too late to get a vaccine, et cetera. So how would you respond to that and respond to maybe people who don't read the full story and understand the empathy that she is trying to convey?
Well, I understand that this is a very emotional topic for a lot of people, and, a lot of people have some very visceral reactions to that, and maybe they don't want to read a very long, nuanced article about this. But I think she is trying to care for her patients in the best way that she knows how. And at a certain point, once the patient is already sick with COVID, then they can't get the vaccine at that time, when they're about to be intubated. However, they have friends, they have family, they have other people who potentially are not vaccinated and are not already so far gone that it's too late. And I think those are really the people that she's trying to reach. She's trying to say, there's only so much we can do once you get to this point. Once you get so sick with this disease, we have some treatments we can try. We're going to do our best to keep you alive and keep you going. But there's only so much we can do after you've got it. The better course for everybody is to prevent you from getting it in the first place. And the way to do that is the vaccine. Obviously the vaccine is not 100% effective. It's 90-something% effective. I think 96% of deaths in Alabama since April have been in unvaccinated people. 94% of hospitalizations were unvaccinated people. So there's a small percentage of people who have gotten the vaccine who still get very ill and who still sometimes die of COVID. But if you can reduce your risk by something like 95%, that's kind of a no-brainer to me. I don't know why you would say, I'm not going to do this if there's a 5% chance that bad things are still going to happen to me.
I'm going through again some of these comments, and one question, I'm not sure that I have the answer in front of me. We can maybe get this for you. Gail wanted to know how many COVID deaths has this doctor seen since the outbreak of the Delta variant. And Gail, I'm not sure if Dennis can answer this question. I am hoping to actually have Dr. Cobia come and talk herself soon about this and about her comments. So, Dennis, do you have an answer to Gail's question?
I do not. I don't have the exact answer. We can look at some of the statewide totals, but I don't have specifically the number of patients that she's seen.
We'll try to get on that for you, Gail, if you're interested. It should be noted that more than 11,400 Alabamians have died from COVID since the beginning of the pandemic in March of 2020. Now, going through some of these questions, this is a really good one, and I don't have the answer right now, and I'm going to get it for you. And I'm trying to find the name of this person, but she made a very good comment. She said, look, you say if you have questions about the vaccine, call a primary care doctor, but what about those of us who don't have a primary care doctor? Who do we call? And I think that is a very important question. I know there are resources for you. I'm going to find them, put them in the comments. But until I find it, Dennis, do you have a response for that question?
No, and obviously it's a question that is a big issue now because our healthcare system is so stressed. A lot of people are saying that to try and get a primary care physician now, there can be a months long waiting list to get that first appointment. But for right now, if you still have questions, I would probably recommend there are some urgent care places that are vaccine clinics that might have a doctor that you could talk to. You might be able to reach out to a county health department or the state health department. They might be able to help you there. Places like UAB hospitals, places like that kind of have some resources there that are available to patients, especially if you have specific questions.
That's a good point there, Dennis. I'm going to see if we can find maybe a direct phone number or something like that to put in here, because you're right. There are a lot of people who don't have primary care doctors, or like Dennis said, maybe you try to go get one. You can't just get an appointment tomorrow. Unfortunately, these waiting lists are pretty long. And again, going through some of these comments here, and we talk about, again, the people who maybe don't read the full story, or who maybe view this as callous or unempathetic of the doctor. But she makes a good statement here that I think is worth discussing. And she says, and she means, I believe, physicians here. She says, quote, physicians kind of go into this thinking, okay, I'm not going to feel bad for this person because they made their own choice, meaning they chose to not get vaccinated. She says, quote, but then you actually see them. You see them face to face, and it changes your whole perspective, because they're still just a person that thinks they made the best decision that they could with the information they had. And she really points at all this misinformation we see. She makes a point later on, going down, saying that when she asks people maybe who are dying or who are being intubated, who are very sick, why didn't you get vaccinated? They say, I saw this thing on Facebook, I got this email, I saw this on the news, and these are the reasons. So somebody made a comment in this chat of saying there was misinformation in this chat. So I just want to say, first of all, do not take your medical advice, please, from this comment thread, from any comment thread you see on Facebook. Please get it from a trusted source, a medical source, etc. But Dennis, what can you say about those comments Dr. Cobia made of saying, look, you think you're not going to feel bad, but then you go in and you realize it's a person who did what they thought was best?
Yeah. I mean, I think that, well, first of all, it's a reminder that doctors are people too. They're humans. They have emotions, and it can be easy for them to say, oh my gosh, I'm having to still deal with this ordeal every single day because people are refusing to get vaccinated, and that even when they make that choice, I still have to give everything that I can give to care for them. And it would be easy to get jaded and to get cynical, under those circumstances when you're having to sacrifice so much of yourself and your job and your work and your life because of the choices that other people are making. But then, it's a reminder that that's probably why she got into medicine, is to help people. And that, that comes back when you look and you can feel empathy for that person, and you can say, maybe they regret that choice now, but they made that choice. So I'm going to help them, as best I can to deal with the consequences of that.
And it's kind of, I've talked to several doctors, and they have told me something that I think is really interesting, and it kind of changed the way I thought about it personally. Is some doctors say, look, you might have the same feeling like Dr. Cobia said. You go into this room and you say, oh, this person's sick. What did they do? What did they not do? And they got COVID. They're sick. They didn't get vaccinated. And the doctors I've spoken to say, that's like going into a patient's room who has lung cancer and saying, oh, did you smoke? Okay. And not having empathy there. And I think that's a really good analogy, because I think that it can take some of the polarization of coronavirus out of it. And it just makes you think a little bit more human. And most people, I would gather, don't look at patients with lung cancer and say, oh, they smoked, no worries. I think that most people do have a little bit more empathy for other diseases, viruses, et cetera, conditions. So I think that's an interesting kind of analogy to this situation that Dr. Cobia talked about. Looking through some of these comments as well. Now, there's nothing like, again, talking to your trusted medical advisor. Pharmacists are also good people to talk with and get their information. Right now, Dennis, if somebody wants to go get a vaccine, where should they go?
Well, the vaccines are pretty widely available now. I think a lot of your major chain pharmacies will have them now. Walmart has them in several locations in Alabama. I believe the website is AL.com, or the Alabama Department of Public Health website has a list of places that have the vaccine and located. And I would suspect that if you call your local pharmacy or your local urgent care clinic or what have you, even if they don't actually have it, I'm sure they'll be able to tell you the nearest place to go to get it.
Looking through, interesting comment here from Donna saying somebody caught one of the new variants and they're so sorry. They said, I did everything right and got COVID. That is so, we've heard from so many people like that. And even Dr. Cobia mentions in this story, Dennis, she's a doctor, her husband's a doctor. They did not do anything that they thought would put themselves at risk. They did not go get groceries. They did not eat out. They didn't do anything. They wore their masks, they distanced, and she still got it. She was actually pregnant when she got COVID last year. She did deliver a healthy baby boy and did not have complications from that. But it is just something that sometimes you can't avoid.
Yeah, absolutely. And part of the reason why there's so much, concern about this, even among folks, I got the vaccine as soon as I, possibly could. But the more this virus circulates in the population, the more chances there are to develop mutations, the more likelihood that, it's going to be out there. And maybe mutate into a form that the vaccines are not as effective against. So far it looks like the vaccines are still pretty effective against this Delta variant, but maybe the next one won't be. And the more people who catch COVID now, the more chances there are for it to mutate and turn into something else. So there is, even if not for your own benefit, for the benefit of the rest of us to finally make this virus go away, getting vaccinated is really the best thing you can do there.
I keep thinking like this is the last question. There's so many good questions that are coming through here, Dennis. So I'm going to ask you a few quick rapid fire questions. And first, I see somebody who said they lost 2 family members to COVID, and just wanted to say we're thinking about you. We're so sorry for your loss, and anybody else here who has suffered that as well. Question here for you, Dennis. Somebody talks about a Johnson & Johnson vaccine saying that they are only this percentage effective, while Pfizer and Moderna are this percentage effective. And we actually kind of in our newsroom had an interesting conversation about those percentages and why they might not be as dead set as we thought they were when they first came out. So give us kind of that quick explanation of why the 66 or 60 something percent effective Johnson & Johnson vaccine, it might be different if you tested it today.
Yeah, it's because of the way they do those clinical trials when they're still evaluating the vaccine to see how effective it is. They give it to a certain number of people, and then they follow those people and see how many of them actually catch the disease. So Pfizer was the first vaccine that got the emergency authorization from the FDA. So those trials were done the earliest. Moderna was after that. The Johnson & Johnson clinical trials were conducted later. And those Johnson & Johnson trials were conducted when the virus was going around more in the community. There were more cases. So the subjects in that study were more likely to contract the virus because they were exposed to it more. So, and, we're still following data on all these people. We're still trying to figure out exactly how effective that is. It's hard to get an actual number. I mean, unless you just take the number of people who get the vaccine and the number of people who eventually get COVID, and you're not going to have that in anything like real time. It takes time to calculate that and to figure it out and to get those numbers. So you want to keep that in your mind. Johnson & Johnson has some great advantages because it doesn't need the deep freeze like the other vaccines. It is only a 1-dose shot. You don't have to go back for your second shot a few weeks later, which a lot of people appreciate. The clinical trials showed a little bit lower efficacy. That's the fancy word they use for how well it works. But again, if those trials were conducted at different times, the results might be a little bit different.
Interesting right there. And that's something that I had never thought about till we talked about it. A question if Dr. Cobia was going to go quote on the record, and she has gone on the record. We have this story again. We're linking it here in the comments that Dennis wrote this morning, and she also did put out some personal Facebook posts from her personal account as well. So I believe that is going on the record and having those quotes attributed directly to her. Again, questions about where you can get your vaccine.
And I will say real quick, she said in one of the comments of her Facebook post that this was one of the ones where she typed it up and then deleted it, and then she typed it up and then deleted again. So she thought long and hard about whether to share this and whether to make this public, because she knew she was going to get some reaction, and she was, a little bit afraid probably of what that might be. But she decided that her story, her experiences were important to share, and that, if it can help some people convince some people to take these steps that could save their life, then, that would be worth it.
Question from Bob, and there was another person who asked a similar question, and this is saying that these are different questions. Bob says, my wife and I have been vaccinated. There is a chance we had COVID. Is there any point in getting tested? Bob, I would think that most people would probably say yes. There was a point of getting tested just so you make sure that you don't pass it to anybody that may come in contact with you. We know that that's not as likely since you say you've been vaccinated, but it can happen. And I think that is what a professional would tell you. I am not that professional, and we will leave any links that are relevant to that here in the comment thread, but that is what I would believe they would say. And I had one more question of saying, I have antibodies. I have been diagnosed with coronavirus. Should I still get a vaccine? And the answer to that is from our local professionals, Dr. Sag, Dr. Marazzo at UAB, who have been on the front end of this, have said, yes, you still should get vaccinated, even if you have had COVID and have some sort of natural immunity to it. My last question for you, Dennis, all of these different things of saying treatments, cures. So let me just ask you, you've been covering this for a year and a half. Is there a cure for COVID-19?
There is not a cure. There are some treatments that can improve some outcomes. We tried a lot of different treatments over the course of this because we didn't know exactly what would work and what didn't. There were some that we thought would work that maybe didn't turn out as well as we'd hoped. There are some that have worked and that have shown decent success at keeping people alive, and you really, that's what it is. You keep people alive until their immune system can fight this off, and that's kind of the status of things right now, and that's where we are. People who
are asking about the different rates of people testing positive for coronavirus right now, for vaccination rates, et cetera. You can find all of that on the Alabama Department of Public Health's website. I will leave a link here to that, so you can go and you can see that for yourself. We are reporting that on AL.com. Dennis has been doing a great job with that. Our own Ramsey Archibald makes a lot of different graphs and maps to where you can see how your county is doing as well. So we will leave all of these relevant links here in the comments. But Dennis, thank you for this story. Thank you for coming on and kind of clarifying some things about this story, some things about these quotes, and elaborating on it.
Yeah, absolutely. And if I could just throw one more word in, Dr. Cobia at the end says, go talk to your primary care physician. That may not be easy for everybody, but I would still recommend that if you can do that, if you do have questions, to do that, to seek out, your doctor or maybe other doctors at UAB hospital or something. My wife is a master's in public health. She's an epidemiologist. And, one of the things she tells me is that from her thesis in grad school was about vaccination rates for different vaccines, not for COVID. But one of the highest correlations is people who ask their primary care physician about vaccines. And the people who do that are very likely to then take the vaccine. So that's a great step that, I would encourage anybody to do that if you have questions.
Good advice there, Dennis, and to Mrs. Fillion as well. So thank you so much for this, Dennis. Everybody watching, thank you for your questions. If you have more direct coronavirus related questions, let me know. Maybe I can get, again, a medical professional on to answer some of those questions directly. So thank you all for watching. We'll see you tomorrow.